By now you've seen our first video, Healthcare Reform, a step-by-step guide, where you get an overview of provisions of the Affordable Care Act. Throughout this video, when you hear me say ACA, that's what I'm referring to, the Affordable Care Act. So what does ACA mean for agents? Before, in the midst of a highly saturated market, the agent had limited opportunity to sell to an individual market because it was not guaranteed issue. But beginning January 1st, 2014, the individual market will be guaranteed issue, and we foresee agents will be dropping out of the market. This creates a great opportunity. The agent market will decrease because all agents will need certification to sell on the exchange, and new products and changing rules with ACA creates confusion. It's going to even the playing field. Experience in the insurance field matters less. You will evolve with the changes or become obsolete because the old way of doing business is gone. So it's a great time to jump in or shift how you're doing business, looking at new markets, for example. And we are all starting at the same level now. So let's talk about selling in this new insurance world. Who's the first target market? The uninsured subsidy-eligible Illinois residents. Until recently, we were concerned that the broker would not be involved in selling on the marketplace to subsidy-eligible individuals, also known as the exchange. But we know now that's not the case. Brokers have been included in sales on the marketplace and will receive commissions based on the total premiums, including the subsidized government-paid portion. Who is the population eligible for the subsidy? Those are the people who fall within the range of Federal Poverty Level, or FPL, between 133 to 400%. For example, in 2013 dollars, that means a single-person household making $15,281 up to $45,906, or a four-person household making $31,321 up to $94,200. It's estimated that 19.8% of Illinois residents are uninsured. Of that, 5% will qualify for a subsidy, or 645,000 people. Estimating commissions at the average rate of 10% with a very conservative $300 per month policy. That's $232 million in annual commission. How much of $232 million would you like? Break it down in manageable goals. Sell one policy per week for $18,720 in annual commission, or 5 policies per week for $93,600 in annual commission, or maybe you want to sell 25 policies per week for $468,000 in annual commission. The ACA requires a cap of no more than 9.5% of annual household income to be paid toward health premiums, but that's based on an escalating scale of FPL. 133 to 150% of FPL, the premium is capped between 3 and 4%. 150 to 200%, the premium is capped between 4 and 6.3%. 200 to 250%, it's 6.3 to 8.05%. 250 to 300%, it's capped between 8.05 and 9.5%. And between 300 and 400% of FPL, the premium is capped at 9.5% of annual income. What do those percentages actually mean in dollars? The subsidy availability is going to make it possible for individuals and families to purchase insurance at a rate that is affordable. Think back to the chart that showed a one-person household earning $15,281 up to $45,960. The total monthly premium they will be responsible for out of pocket is $38 up to $363. People who fall into this range are the people who we really see as the target market. Take another example. A family of 4 who you remember could earn $31,321 up to $94,200. They will have their premium capped at $78 up to $745. Even in today's market, a family of 4 pays much more than $750. It's more like twice that. Our charts only depict examples of households for 1 and 4 people, but it's really just a simple math problem to fill in the gaps or include additional household members. The Kaiser Foundation hosts a subsidy calculator on their website. Until the market opens on October 1st, provide their link to your clients so they can get an early estimate of how much subsidy they could be eligible for. Open enrollment for both on and off the public marketplace begins on October 1st, and for this first enrollment will extend to March 31st, 2014. But application deadlines are firm. An application must be processed between October 1st and December 15th for a January 1st, 2014 effective date. Then December 16th to January 15th will receive a February 1st effective date. January 16th through February 15th will receive a March 1st effective date. February 16th through March 15th will receive an April 1st effective date, and March 16th through the 31st will receive a May 1st effective date. On March 31st, the individual market closes until the next open enrollment period beginning on October 1st, 2014, which then only extends until December 7th. Off open enrollment, the only way someone will be able to purchase an individual policy is through a qualifying event, such as loss of group coverage. If you are an agent who uses paper applications with your clients, it's time to make a change. There are paper subsidy applications available, but you may find it's not time effective. We recommend online applications like the Express Link. It's a free online application tool provided to every contracted Blue Cross Blue Shield producer. It embeds your agent number in the online application process, which ensures you get paid on the policy. It's available to use now. It will be a powerful tool starting with open enrollment. At that time, through ExpressLink, individuals will be able to calculate their subsidy. Agents can sell subsidized plans and get paid full commission, and then you will be selling more with less work. The online applications scrub themselves. Notify the user of missing information immediately. A paper application has to be mailed in and processed manually, and that's only if it's complete the first time. If there's missing information, it will have to come back and be corrected, then resent. It will take too long. To access your Express Link, go to www.hscil.com. Click on Producer Services. Log in. If you have never logged in before, create a new user. On the top of the page, click on Express Link. From there, you have two choices. Use the HTML link to email to clients, and use the embedded link to put on your website. For further assistance, use our infographic, also available on our website. If you do not already have a website, you need one. It's another way individuals can access your Express Link. We recommend 3 services: benefitstore.net for a template-based, quick and easy site, norvax.com for a more tailored website, and quotit.com, which will allow customers to quote multiple carriers at once. MIBS has arranged for an affiliate discount with Benefit Store for our agents. The normal cost for an agency website is $69.99 a month. With the MIBS discount, you pay $49.99 a month. Contact Ken French for details. Let's talk marketing strategies, like what to do with your current groups. Get a master list of your groups from your commission statements and determine their size. Determine which are grandfathered or non-grandfathered. Educate yourself. Will those small groups need to be disbanded? Look at your group's voluntary coverages and stay on top of those to ensure you keep other agents out of that group. And identify groups with part-time employees because there's individual policy opportunity there. For your grandfathered groups, and remember that's any group written before March 23, 2010 which made no material change. Recognize those Blue Cross Blue Shield groups as plans that start with the letter E. You can remember it as E stands for exempt from essential health benefits. Talk to these groups about staying grandfathered for now if possible. Educate them and establish yourself as an expert. Give them the ACA guide for clients available on our website. Continue to help them with normal group service issues, and you can always talk about whether disbanding is an option in the future. For your non-grandfathered groups, continue to communicate and educate them as much as possible. Provide them with the ACA guide for clients available on our website. Be sure to discuss their early renewal options, and still consider whether disbanding is an option in the future. Why would disbanding a group be advantageous? Well, first of all, a group requires more paperwork. There's the MSP, the BPA, the BPS, the EGI, employee applications, the wage and tax, a binder check. And then there's servicing issues, COBRA or Illinois continuation to consider, and there's always the possibility of an audit. On the individual side, there's just the application. If you disband a small group, Consider the guaranteed issue policy commission that translates into, for example, using current commission rates. A 6-life group which has 3 individuals with commission at $30 each for $90 a month, and 3 families at $60 for $180 a month equals $270 a month or $3,240 in commission annually. That same group disbanded, converted into 3 individual policies and 3 family policies at 10% commission is a total of $5,400 in commission. That's an increased commission of 67% over the group. One more example, a 3-life group. 1 individual in commission is $12 a month and 2 families in commission is $48 a month for a total annual commission of $720 for the group. Disband that group for 1 individual policy for $30 a month in commission and 2 family policies for $120 a month in commission for a total annual commission of $3,240. That's an increase of 400% over the group. After the group has disbanded, the money that the employer is no longer spending on health premiums can now go toward providing employee benefits without increasing taxable income, like dental, life, vision, STD, LTD, critical illness, accident plans, or 401k. Extra benefits to your clients equal extra commission to you. MIBS offers ancillaries with Dearborn National, Humana, Lincoln Financial, Reliance, Guardian, Aflac, and Securian. Identify places where you can find subsidy-eligible individuals. People who qualify for the subsidy are a much easier sale. They're likely uninsured. And remember, their premium is capped based off their household income. Just make sure your audience doesn't fall into the Medicaid range, as they may not be eligible for the subsidy. So talk to groups with part-time or 1099 employees. Talk to people at churches, restaurants and bars, flea markets, farmers markets, trade shows, people who make between $18,000 to $20,000 on paper, like individuals who work at hair salons, or groomers. Other marketing ideas to get in the door of a business include information surrounding ACA. Talk to them about the fines, ask if they are compliant, and educate them on the exchange notice. The exchange notice comes in 2 different versions, one for employers who offer coverage and one for employers who do not offer coverage. In either situation, every employer must complete and give the appropriate notice out to every single employee by October 1st, 2013. Acceptable delivery is United States mail or email if the electronic safe harbor is met. The exchange notice is the single best marketing tool available to you. We have provided these forms on our website with space for you to include your own contact information with your express link. Give the notices to your current and prospective groups electronically, and then anyone seeking coverage has immediate access to your express link, and by extension, you to assist them, and you get the commission. This guide, ACA Percentages in Real Numbers, is another good in-the-field marketing tool. It's a quick reference for the FPL subsidy ranges, premium cap percentage, and premium cap in dollar amounts. At the bottom is a guide to the 9.5% affordable coverage threshold by annual income. Your marketing plan for success starts here. Get your express link set up. Complete your website or touch up your current website now and utilize all available resources like the express link, Quoted, and social networks. Be sure you have a clean web presence when you Google yourself. Again, get a list of your current groups to stay on top of grandfathered status, renewal dates, and consider an ACA strategy. Most importantly, stay in communication with your clients. Any group you aren't talking to right now, another agent might be. Assure your group that you're keeping track of what's happening with the new law. On the individual side, find your market and where to reach the most subsidy-eligible people. Consider how you want to approach them. Maybe start a partnership with another agent. Plan for open enrollment and be ready to enroll as many of those individuals as possible. By September, all of your planning and preparing should be over. That's a great time then to complete the CMS certification, which is already up and running. See our website for the link to log in and for instructions. Also, be aware that September is likely the time for new product training. And then, between October and March of 2014, enroll as many people in the individual market as possible. If people do not enroll during open enrollment, they will have to wait until 2015 to start their coverage. Sell to as many subsidy-eligible uninsured as possible, and disband small groups as appropriate. In April 2014, go back to existing groups. If they didn't disband in January, you can still disband any time throughout the year, and also add group-sponsored ancillaries, like 401k. Assist employees enrolling in individual coverage as necessary. Quote the group out to other carriers if they aren't disbanding. Circle back to groups keeping coverage with voluntary ancillary coverage, like critical illness, accident, vision, or dental. These benefits cost nothing to the employer, the premium is low, and gives the employees added benefits. But continue to educate no matter what the group decides. For a January 1, 2015 effective date, the open enrollment period starts for those who did not enroll during the first enrollment or who wish to make a plan change without a qualifying event on October 15th through December 7th, 2014. And now you've seen how we think you can tackle this new law and make money from it. Are you ready? Call us if you have questions.